Hello, this is Kim McAllister, and have reached the grand finale of our respiratory drug chapter. We're going to talk about nursing implications for patients taking all of these medications and with all of these conditions, and we're going to look at some specifics for specific medications as well. So in general, for all patients who are experiencing either asthma, COPD, or emphysema or other respiratory issues, they need to do as much as they can to make themselves as healthy as possible. One of those things are to avoid things that will cause acute exacerbations, like anything that they're allergic to, removing it from the home. It's helpful if they don't have carpet or curtains, things that can be dusted easily. They don't need to have a lot of clutter around that collects dust. Also, if they have pets, getting the pets washed and bathed or groomed regularly. They should have a full allergy evaluation to determine what things they are allergic to so that those things can be avoided. They need to have adequate fluid intake. Most of these medications are very, very drying. You'll notice that the side effects for nearly everything were dry mouth, so they need to be encouraged to drink fluids, as long as that's not contraindicated because of heart or kidney problems. They need to be compliant with medical treatment. If patients are not being compliant, ask them why, find out what the reasons are, because many times it's from some kind of issue, maybe outside their control, something that you could help them with. They need to avoid excessive fatigue because fatigue is a trigger for problems. So they need to schedule their day carefully so that they have some rest periods during the day. They need to avoid extremes in heat and cold, and they need to avoid caffeine. Patients with respiratory disorders need to receive prompt treatment for flu or other illnesses, and they need to be vaccinated every year for flu and every 5 years for pneumonia. Patients should always check with their physicians before taking any over-the-counter medication. As we went through all these medications, you'll notice a lot of the side effects were for the bronchodilators especially, were pretty strong as far as heart and blood pressure issues. So it's very important that they discuss any over-the-counter medications with the prescribing physician. And they need to make sure that all of their providers or physicians are aware of all the medications that they're taking. So when you begin to take care of a patient with respiratory issues, you need to do a full assessment. You may remember me saying in class, your assessment is your best friend, and that's absolutely true. You need to have a baseline of where this patient is, either when they come into the hospital or as you begin your shift. You want to look at things that indicate their respiratory status, like skin color, assess their capillary refill, check their vital signs, respirations, how fast are they breathing, what's the quality of the respirations, are they deep, are they shallow, are they able to fully expand the lung, can you hear air moving all the way into the bases of the lungs. Check their pulse oximetry. Are they producing any sputum? If so, what are the characteristics? What's the consistency? What's the color? Do they have allergies? If so, what kind of allergies do they have? Cover allergies to medications, allergies to other things such as grass or mold and so forth. Make sure that you do what you can to eliminate any allergens from their environment in the hospital. Find out if they have a history of respiratory problems, and if so, what they are. What medications have they been taking? Sometimes the medications can be your best clue as to what kind of issues the patient's been having. You need to teach them to take all of their medications as prescribed, particularly bronchodilators. Make sure they know how to use their inhaler. You can have them show a return demonstration. Let them show you how to use it. And then you need to monitor for any adverse effects and also monitor for the effectiveness of the medication and the treatments. So which medication should the patient use when they're having an acute asthma attack? Would it be albuterol, salmeterol, theophylline, or montelukast? Hopefully you said albuterol. So monitoring a patient for therapeutic effects for respiratory drugs are going to be looking for relief from the reasons that they're taking it. So decreased dyspnea, so that they're not having as much trouble breathing. Decrease wheezing, restlessness, anxiety. Remember, people get very anxious and nervous when they don't breathe well. Improve respiratory patterns with return to normal rate and quality. Is their respiratory rate normal? Are they breathing normally? The quality of the respiration. Is it shallow and gasping, or is it normal? Is it deep and full? Are they able to do more? Be sure you record what their activity tolerance is, because this can be a very good indicator of how well these medications are working. They should be reporting fewer symptoms and be able to breathe easier. Another important thing to note and to instruct patients about if they're on albuterol is if they use it too often, it can begin to affect the heart. And so patients need to be told how often to take it and not to double up on it. Be sure that patients take their medications exactly as they're ordered. They don't need to skip doses or take double doses. Sometimes patients will take 3 or 4 times what they're supposed to take, and we really don't want people to do that. They need to report severe problems such as insomnia or jitteriness, restlessness, palpitations, chest pain, or any change in symptom. So for xanthine derivatives, any contraindications or histories of peptic ulcer disease or GI distress or disorders. They're used cautiously in cardiac disease. You may remember that they do cause increased contractility and increased heart rate, therefore increased cardiac output. If they're taking any of these medications that are time release, they don't need to chew them or crush them. They need to report nausea, vomiting, restlessness, insomnia, irritability, and tremors to the provider. They need to be aware that Tagamet or cimetidine can have interactions. Oral contraceptives, because of the gastric distress, that can interfere with the normal flora that are required for the oral contraceptives to break down and be used. So patients on oral contraceptives need to be told to use an alternate form of birth control while they're taking this. Allopurinol, certain antibiotics, like rifampin and other antibiotics, influenza vaccine, and others. Cigarette smoking enhances xanthine metabolism and also interferes with respiration and aggravates respiratory disorders. Foods that have been broiled over charcoal, high protein and low carbohydrate foods can also be a problem. They can reduce the level of the medication. Your leukotriene receptor antagonist, be sure the patient is using the drug for chronic management, that they understand that this is not something that they take during an acute episode because it won't work well, and because this is not a bronchodilator. Teach the patient the reason for taking it and that it may take up to a week before they notice any improvement. They need to check with the provider before taking any over-the-counter medications, and they need to have their liver function test before therapy and throughout. Patients need to take it at night on a continuous schedule. Patients using inhaled corticosteroids need to gargle and rinse the mouth afterwards to prevent oral fungal infections. And as I mentioned earlier, if a beta-agonist bronchodilator such as albuterol and a corticosteroid inhaler are prescribed, they need to use the beta-adrenergic inhaler first to open up the airways, and then use the corticosteroid second. It will have better penetration into the tissue. Patients need to monitor the disease with a peak flow meter. Encourage the use of a spacer device to ensure successful inhalations. A spacer is a device about this long. They put the inhaler in one end and the other end in their mouth. They depress the inhaler, and it fills up the spacer, and then they can breathe in the medication. If patients put an inhaler directly in their mouth and depress it, the majority of the medication hits the back of the throat and does not go into the lungs. So a spacer allows the medication to be aerosolized better and go directly into the lung by breathing it in. Patients need to clean their inhalers and nebulizers after use. If a patient's on an inhaler, make sure the patient is able to self-administer the medication. If the patient's not able to do that, then when they go home, they won't be able to use it correctly. So the best way to know if a patient is doing something correctly is to have them do a return demonstration. Be sure they know when they're supposed to take it and how often. Again, use the spacer if they need help. Turn the inhaler around and show them the counter on the back of the inhaler. When it goes to 0, they need to throw it away and start the next one. The inhaler will continue to produce air when they depress it, and they may think that they're getting medication, but they're just getting the propellant. So it's important for them to understand that they have to keep track of that. And this concludes our respiratory chapter. Thank you for your attention, and I hope that you found this helpful.